Hello and welcome to Health Office. If you're looking for ways to live a healthy lifestyle, you've come to the right place. But before we dive into the tips, make sure to hit that subscribe button and turn on notifications so you never miss out on any of our valuable content. Contraceptive methods refer to the techniques used to prevent unwanted pregnancies. There are various types of contraceptive methods, including hormonal methods, barrier methods, intrauterine devices, IUDs, natural methods, and emergency contraception. We will explore the different types of contraceptive methods, how to use them, and their advantages and disadvantages. Hormonal methods involve the use of hormones to prevent pregnancy. The hormones can be in the form of pills, injections, patches, or vaginal rings. They work by preventing ovulation or thickening the cervical mucus, making it difficult for sperm to reach the egg. Advantages: highly effective when used correctly. Easy to use. Reduces menstrual pain and cramping. Regulates menstrual cycle. Disadvantages: requires a prescription from a healthcare provider. Does not protect against sexually transmitted infections, STIs. Can have side effects such as nausea, weight gain, and mood changes. Some women may experience irregular bleeding. Barrier methods involve the use of physical barriers to prevent sperm from reaching the egg. They include condoms, diaphragms, and cervical caps. Advantages: easy to obtain without a prescription. Protect against some STIs. Can be used immediately without waiting for the body to adjust. Can be less effective than other methods. Can interfere with sexual pleasure. May require additional spermicide for maximum effectiveness. Intrauterine devices, IUDs, are small T-shaped devices inserted into the uterus by a healthcare provider. They work by preventing fertilization or implantation of a fertilized egg. Advantages: highly effective when inserted correctly. Long-lasting, can last up to 10 years. Low maintenance. Hormonal and non-hormonal options available. Disadvantages: requires insertion by a healthcare provider. Does not protect against STIs. Can cause cramping and discomfort during insertion. Can increase the risk of pelvic inflammatory disease, PID, in some women. Natural methods involve tracking a woman's menstrual cycle and avoiding sex during the fertile period when she is most likely to become pregnant. This method can include the use of fertility awareness methods, FAMs, such as basal body temperature and cervical mucus tracking. Advantages: no hormones or devices required. Can be used by women who cannot or prefer not to use other methods. Can help women understand their menstrual cycles. Disadvantages: can be less effective than other methods. Requires consistent and accurate tracking. Can be difficult to track for women with irregular cycles. Does not protect against STIs. Emergency contraception refers to methods used after unprotected sex to prevent pregnancy. They include the use of emergency contraceptive pills, ECPs, or the insertion of a copper IUD. Advantages: effective when used correctly. Can be used up to 5 days after unprotected sex. Hormonal and non-hormonal options available. Disadvantages: does not protect against STIs. Can cause side effects such as nausea and vomiting. Can be less effective than other methods if not used correctly. In conclusion, there are various types of contraceptive methods available for individuals to choose from based on their preferences, needs, and lifestyle. It is essential to discuss contraceptive options with a healthcare provider to determine the best method for each person. It is also important to remember that no contraceptive method is 100% effective, and using multiple methods may provide greater protection against unwanted pregnancy.